In this video, you will learn how to measure someone's waist to hip ratio just by using a tape measure. Measurements of the waist and hip body circumference can be important to quantify body fat distribution. Determining this ratio may give someone a better description of their health when compared to just their weight or body mass index. Here is a chart showing the risk zones for waist to hip ratio for both males and females. Taking measurements of the hip and waist is an easy skill to keep in your toolbook because all you need is a flexible tape measure and calculator. Before beginning, make sure to ask the client permission to move their article of clothing and if you're allowed to touch them. Once they are in a comfortable position, you can take your tape measure and begin. The clinician should be in a crouched position on the right side of the client. Waist circumference is typically measured at the narrowest point above the umbilicus or belly button and below the xiphoid process of the sternum. When measuring, make sure to line up the 0 with the number on the other part of the measuring tape. Hip circumference is measured as the largest circumference around the buttocks above the gluteal fold. Also, you want to make sure to line up the 0 with the number on the other part of the measuring tape. The procedure should be repeated for both the waist and hip measurements to ensure accuracy. Both numbers should be recorded on a piece of paper so we can divide the waist number by the hip number to get the ratio. Before taking measurements, you want to make sure that they're taken on the client's right side on bare skin. You want to avoid taking it from the front as it could be uncomfortable to the client. When measuring, you want to make sure that the tape measure is not too tight around the waist or hip or even too loose. You want to make sure that it is snug around the person but not tight enough to constrict and cause the skin to fold. Make sure that the tape measure is parallel to the floor, not twisted, and is not slanted. Overall, the waist to hip ratio is an accurate indicator of whether or not someone is at a higher risk for developing heart disease or diabetes based on excess fat around the waist. This is a quick and efficient tool that is inexpensive and used by many clinicians. This assessment can be done on any age and has norms based on gender. The waist to hip ratio should be 0.85 or less for women and 0.9 or less for men.